Hi guys, today is going to be day six of your daily reminder to study for the NCLEX exam. So today we're going to be speaking about antibiotics, right? So let's get started and we're just going to go over a few notes, okay? So let's speak about antibiotics that are toxic to the kidneys and toxic to the ears, right? They cause nephrotoxicity and ototoxicity. And these antibiotics end in mycin, right? So we have vancomycin, gentamicin, neomycin. So when they're toxic to the ears and cause ototoxicity, your client might complain of ringing in the ear. That's tinnitus, or they might complain of vertigo, right? And if they're toxic to the kidneys, causing nephrotoxicity, what are we going to see is going to be our clients are going to have an increased BUN and an increased creatinine, right? And we know creatinine over 1.3 is bad for our kidney, right? So what are we going to do with these medications? The doctor is going to order a peak and trough, right? And a lot of times we might ask, what's the peak and trough? Well, the peak is when the medication is at its highest, right? And if we're given the medication IV by the IV route, what's going to happen is that we're going to draw the peak after 30 minutes, right? And if we're given the medication by mouth, we're going to draw the peak after 1 hour, right? And for the trough is when the medication is at its lowest, and we're going to draw that 30 minutes before the next dose, right? So we monitor the peak and trough because we want to make sure that there is enough medication in the blood to be effective and kill the bacteria that's making the client sick, right? Okay, so now let's go over some other notes about antibiotics. Let's speak about the antibiotics that are not taken with food. We take them on an empty stomach and with a full glass of water. And the class of those antibiotics are macrolides, tetracyclines, and fluoroquinolones. Okay? Those are the medications that we're not going to take with food. We're taking on an empty stomach with a full glass of water. And now let's speak about the antibiotics that causes photosensitivity, right? So those antibiotics are the fluoroquinolones, the tetracyclines, and the sulfur drugs, right? And so with those antibiotics, we're going to educate our client to avoid direct sun exposure, right? Because they can get easily sunburned. So our client, we're going to educate them when they go outside, they should wear sunscreen, they should wear a wide brim hat, they should wear clothing that covers the arms because they're at risk for sunburns. So guys, those are the quick notes for today on antibiotics. Okay, I'll see you in the next video for our daily reminder to study for the NCLEX exam. See you soon. Bye-bye.